Sports place your body under stress, and that's why they help you stay healthy. As your body learns to adapt to that stress, it becomes stronger. However, this is also the reason why, if you plan on participating in any sort of physical activity, you should get a sports physical first. In this video, you'll learn why getting a sports physical done is so important for children, and how E7 Health can help young athletes stay healthy. Let's start with the basics. A sports physical, sometimes called a pre-participation physical, is a type of medical exam that checks if the individual is in good enough health to partake in their sport or activity of choice. Many schools and organizations require a physical before the student or athlete is allowed to participate. At a minimum, the healthcare provider performing the exam will first discuss the patient's medical and family history, particularly any instances of asthma, heart problems, head injuries, muscle or joint complications, allergies, and diabetes. The exam itself typically includes checking the patient's blood pressure, breathing, heart rate, weight, height, and vision. The goal is to ensure that the body's main systems and processes are functioning properly, including the heart, lungs, joints, and sense of balance. While this isn't always the case, some healthcare providers will further tailor the sports physical based on the patient's particular sport and the unique demands it'll place on the body. For instance, a sports physical for a football player might look slightly different from a sports physical for a ballet dancer. The exact details of the exam could also change based on any requirements of the particular organization that the patient is competing under, if any. Note that this is the reason why a sports physical isn't necessarily the same thing as a regular or annual physical. When parents schedule the appointment, they should ensure that they specify it's a pre-participation physical. So, when should parents schedule their children's sports physical? Ideally, this should happen 6 to 8 weeks before their activities begin. We do this so that in the event that the patient has any issues that need to be addressed, there's time to do so. But what happens if you fail a sports physical? When we say fail, we mean that the healthcare provider found something that warrants a follow-up appointment. For example, if the patient wants to take up long-distance running, but they have asthma, the provider may suggest they follow up with a specialist. If the patient wants to play football but already had a knee injury a few years back, the provider might want them to take additional measures to ensure that their knees stay protected and strong during practice and games. In this way, sports physicals are an important part of the individual's overall preventative health plan. This is the patient's opportunity to confirm that they're healthy enough to be more active, or if any issues are found, to address them before they potentially become more severe. So, could this physical prevent someone from playing their sport? Technically, yes, but this would only happen under more extreme circumstances. For example, if a child was born with a heart or brain defect, then high-intensity and high-impact sports like football might not be a safe option. Sports physicals with these types of outcomes will likely be the exception to the rule. And how can E7 Health help? E7 Health offers complete sports physicals for students and amateur and professional athletes. We also provide discounts for high school and college students. We strive to make getting your exam as convenient as possible, so we offer same and next day appointments. Patients should show up to their appointments with any physical forms or documents that they need the provider to complete. They should also be prepared to provide information about their medical and family history, as well as any past surgeries. Any patients who are a minor should come to their appointment with a parent or legal guardian. If during the appointment no conditions or limitations are found, then your clinician will most likely clear you to move forward, in addition to completing any necessary paperwork. If anything is found that requires further attention, they may direct you to do additional testing, evaluation, or treatment. Please note that sports physicals are different from standard school physicals, although parts of the exam will be similar or the same. Sports physicals are more tailored to determine if the patient's body can handle being put under more extreme stress. As a preventative health clinic, E7 is a leading provider of student, employment, and travel health. STD testing, physical exams, lab services, and drug testing. We're also a leading vaccine provider in Southern Nevada, in addition to offering blood titers to check patients' current immunity. Conveniently situated in 2 Las Vegas locations, we offer same and next day appointments, which can be booked online. Are you a new patient? Register online with us now, or you can book your appointment in just a few clicks. If you have questions, comments, or concerns, contact us for more information.